Hello everyone, my name is Yusof. I'm a consultant rheumatologist from Leeds. I'm reporting live for Room Now at Chicago for the ACR 2025 conference. Today I'm delighted to be joined by my colleague who is a worldwide expert in lupus, Professor Edward Vital, where we will describe about his abstract number 1526. Hello Ed.
Hi.
So first and foremost, would you please highlight to us about the objective of these guidelines and how the guideline was developed?
There have been a lot of guidelines recently for SLE, and all of them consistently say that steroid doses should be lowered, shouldn't be used long term, and doses should be tapered as quickly as possible. The problem is that although guidelines have said that for a long time, and with good reasons, because steroids are associated with damage, in practice that doesn't always happen. Managing lupus is quite complicated, it's difficult for the doctors and patients, and in reality steroids are not tapered in the way that guidelines say. We did a review article that showed that. So the purpose of our project was to come up with a set of consensus statements and also, most importantly, steroid tapering protocols to try and improve adherence to good practice.
And is this like a internet consensus, expert opinion, or evidence-based consensus?
It's expert opinion. So we had a group of over 120 experts from across different specialties involved in the management of patients with SLE and trying to represent most areas of the world. And we started with a steering committee drafted list of potential statements and also of potential steroid protocols. For example, for a mild flare, start at this dose, taper down over 3 weeks. For a moderate flare, start at a higher dose, taper slowly. For a more severe flare, we actually took some published protocols for lupus nephritis, and then there was also a protocol for a patient who's been on long-term low-dose steroids and wants to get off it. And there were some other statements about other aspects of steroid use. So like a usual Delphi process, there were a couple of iterations of voting. So in the first vote, some statements were just accepted, some statements were clearly rejected, others could be refined and nuanced into repeat rounds until we got the best consensus we thought we could achieve.
So I think out of all the statements that are there, I mean, obviously we can't describe it all, would you please just highlight maybe like 2 key points, statements in the guidelines?
I mean, I think really to me the core of it is to say, have a plan. So one of the statements is that whenever glucocorticoids are being initiated, there should be a plan for how it's going to be tapered to zero. And in reality, what people will often do is say, start on 20 milligrams of prednisolone, come and see me in 2 weeks, we'll see what happens. Or maybe give some reduction plan, but when the patient comes back, they didn't do exactly what you expected. So our idea is if you just have a table with the dose should be on certain dates, it will work better, especially if they're seeing different doctors. Maybe you'll have to change from it. Maybe it'll be too fast, maybe it will be too slow. You might deviate, but just have a plan.
And lastly, now that this is now established, which is what we're all waiting for, I'm just wondering whether in terms of dissemination, so apart from showcase it in this conference, anything else that you and your steering committee would do so that people will uptake the guidelines.
Very good question, and that's exactly what we're working on over the next year. I don't know exactly what they'll be yet, but our plan is to develop a set of tools to help use that in the clinic, whether that's simple tables, tools to work out the doses, handouts for patients, apps. There's a variety of possibilities, but it's really, there's no point writing guidelines if they're not followed.
So thank you so much, Ed, for summarizing your work and on behalf of your committee. So hope you find the discussion interesting, and hopefully you can see the protocol itself when it'll be come out and be published formally. In the meantime, so follow me at Twitter at U6Yusof and also other faculties at Room Now for more content coverage. Thank you, everyone.
Thank you.